29-year-old Chicagoan Felisa Castro has lupus, a chronic autoimmune disease with no cure.
I first found out I have lupus in 2009. I had lesions that were forming on my face. I didn't know why. I kept going to the doctor and they kept misdiagnosing me.
Castro went into seclusion and says the strong drugs prescribed only made her feel more sick and depressed, so she turned to cannabis for help.
It was definitely an immediate improvement, but it wasn't some like miraculous physical benefit. It wasn't like all of a sudden my lesions were gone and I was cured. It was like all of a sudden I felt better overall, just about my overall condition. I felt like I wanted to eat, like my stomach felt better.
Castro was one of the first medical cannabis patients in Illinois. She says her condition improved so significantly she decided to open the Healing Clinic on Chicago's North Side to help others learn about the program. To qualify, a patient must have one of 39 conditions, be able to show current medical records, proof of residency, age, have a photo ID, undergo a federal background check, and pay an application fee. There are more than 12 million people living in Illinois, but only about 15,000 patients are registered in the state.
There's a lack of awareness. I think that many patients don't know that the program exists, that medical cannabis is a viable treatment option. I mean, doctors aren't really talking about it.
Dr. Jonathan Spiro is the certifying physician at the Healing Clinic. He says most doctors aren't educated about cannabis, and even he was skeptical at first. But after doing extensive research and working with patients, he's convinced it helps people live more comfortable lives.
It's remarkable how beneficial cannabis can be for so many different conditions. I always like to say that if we'd never discovered medical cannabis or cannabis in general, and someone went into the Amazon and found it, they'd probably get a Nobel Prize for medicine because it's that powerful.
Last year, Governor Rauner expanded the medical cannabis program to include PTSD and terminal illness. Dr. Aaron Weiner, Director of Addiction Services at Linden Oaks Behavioral Health in west suburban Naperville, Illinois, says using cannabis can make some conditions worse, and he was shocked by the move.
If you start smoking cannabis to help with symptoms of PTSD, you're going to still have PTSD, but you're also on the road to developing an addiction. And even in addition to that, what getting intoxicated does is it allows you to avoid your experiences, it allows you to avoid your feelings. And a huge part of therapy for PTSD is connecting with those and resolving those.
Dr. Weiner says there is limited evidence that cannabis helps patients, which is why he believes doctors are hesitant. He sees the program as more of a business opportunity, and he's especially concerned about the marketing towards children.
People are pouncing on it and developing vape pens, for example, that kids can conceal in backpacks, that are making gummy bears, that are making products that are aimed clearly at children, because 90% of addictions start when you're a teenager.
Illinois now has 51 dispensaries and 21 cultivation centers. The state's program remains one of the most regulated in the country. Shay Evans is Director of Patient and Physician Outreach at Modern Cannabis in Chicago's Logan Square neighborhood. She also suffers from lupus and says her life has dramatically changed for the better using cannabis. She applauds the tight security and strict rules.
In other states, patients can go and shop from dispensary to dispensary, whereas in Illinois, you can designate any dispensary that you would like. However, if you'd like to go and purchase from a dispensary, you need to designate to that one. It's just to help tighten down on our dispensing of product to make sure that nobody goes over their limit. And the traditional limit of a patient is 2.5 ounces every 14 days.
The state also makes sure all products are tracked from seed to sale so patients know exactly what they are getting. 2 years ago, when the medical cannabis program began, Illinois State Police increased field training for all officers. That included a series of steps to better recognize what an impaired driver looks like, whether alcohol or drugs are involved.
The final test we're going to do is a one-leg stand test.
1001, 1002.
But the impact of medical cannabis on road safety remains unclear.
Right now, we just have the overall stats of number of DUI arrests in total compared to previous years, and there's no specific data right now that I have to show that there's an increase in marijuana-related DUIs over this year other than prior years.
A recent Gallup poll shows 60% of Americans support the legal use of marijuana. According to a 2016 study conducted by the Paul Simon Public Policy Institute at Southern Illinois University in Carbondale, 4 in 5 Illinois voters support medicinal cannabis, but less than half support legalization for recreational use.
Whether we'll go recreational, people ask me that all the time. I think we're further behind the recreational states.
With limited broad data and scientific evidence, it's more likely Illinois will continue to focus on its medical cannabis program, which expires in 2020.